Gastric Sleeve Diet, plus Gastric Sleeve Cookbook, plus Gastric Sleeve Recipes. 3 in 1. The complete guide for planning what to do and eat before and after your bariatric surgery. Written by Mike Edwards. Narrated by Austin Mayer. Gastric Sleeve Diet. A concise guide for planning what to do before and after your gastric sleeve surgery. Written by Mike Edwards. Narrated by Austin Mayer.
Chapter 1. Be sure about your procedure choice. What gastric sleeve surgery is. The other name for this procedure is sleeve gastrectomy. It is a restrictive operation that makes your stomach smaller so that you will feel fuller quicker and eat less food. This procedure involves the removal of more than half of your stomach. After your surgery, only a vertical tube that is about the size of a banana is left. This surgery should be considered as a tool for weight loss rather than a quick fix, because the patient will need to eat a healthy diet and exercise following the surgery. It is not cosmetic surgery where fat is removed. Only part of the stomach is removed. History. United Healthcare, insurance, added sleeve gastrectomy to their list of surgeries that they cover for weight loss on January 1, 2010. Almost all other major health insurance companies began to cover this procedure during the next 2 years. It is extremely difficult to get health insurance companies to approve new procedures, but gastric sleeve surgery was approved because there was evidence that the procedure brought about significant weight loss and the complication rates were low. Additionally, surgeons were already doing the procedure on patients who were covered by insurance. This was an accomplishment because surgery on obese people is riskier than surgery on people of normal size. The gastric sleeve procedure initially was the first of 2 surgeries that were normally done. Insurance companies paid for the first surgery and then paid for the second one a year or so later after weight was lost. However, it was discovered that the sleeve procedure was successful in getting people's weight off without the second surgery being done. Sleeve patients lost as much weight as the gastric bypass patients did over time. The gastric sleeve procedure proved to be quicker, less complicated, and safer than the gastric bypass procedure, and the surgeons quickly started to prefer performing the sleeve operations. Patients liked the results too because they didn't just experience hunger anymore. In fact, some of them had to remind themselves to eat. Reasons for gastric sleeve surgery. This surgery is done to help people to lose weight and to keep the extra weight off. This procedure is done when the patient is severely overweight and has been unable to lose weight through diet, exercise, or medicine, and where emotional eating was not the cause for the weight gain. Even though the smaller stomach can eventually be stretched out to accommodate more food, this surgery encourages the patient to eat less food so that obesity won't remain a problem. Candidates for this procedure have a body mass index that is 40 to 60 or even higher, and/or they have a weight-related, life-threatening, or disabling problem and a body mass index of at least 35. Studies show that obese people who undergo this surgery are less likely to die from cancer, diabetes, and heart problems than obese people who never lose the weight. The gastric sleeve procedure is less risky than a gastric bypass is because the small intestine is not divided and reconnected like it is in a bypass procedure. Major complications that require reoperation occur in less than 5% of gastric sleeve patients. Even though the gastric sleeve surgery is now often the only gastric procedure that is performed on the patient, it is still sometimes done as part of a larger approach where this surgery is followed up with an intestinal rerouting procedure. The weight loss that occurs as a result of the first surgery often makes the second one unnecessary. Sometimes a surgeon who goes into surgery planning to perform a gastric bypass procedure changes his mind during the operation in favor of performing a gastric sleeve procedure because of an enlarged liver or an extensive amount of scar tissue in the intestines that make a gastric bypass impossible. Other reasons people get the gastric sleeve surgery include body severe comorbidities, Crohn's disease, advanced age, a need to surveil the stomach or to continue taking specific medications, or any combination of the above that increases risk for the patient if the bypass procedure were done.
Sample complete. Ready to continue?